an easy way to draw the cross section of the leg. First of all, let us draw the circumference of the leg. Now, the first bone we have to bring in is the tibia. So, if you palpate your tibia, you get something like this. So, this is the anterior border of the tibia. This can be considered as the medial border of the tibia. Now, this part is the superficial part. We can palpate it. The surface of the tibia can be palpated subcutaneously. So, this is the tibia. All right. Okay. Now, let's go to the next bone, that is the fibula. Fibula, as we can see in the middle part, you won't be able to palpate the fibula at all. So, the fibula is deeper. Not like tibia, fibula is deeper, so there are muscles in this part. Now the next thing we have to draw is the intermuscular septum. So that is the interosseous membrane. So this is the interosseous membrane between two bones, the fibula and the tibia. Now the next one you have to draw are the two septums, namely the anterior intermuscular septum and posterior intermuscular septum. Now we can notice something like the interosseous membrane, anterior and posterior intermuscular septum are attached to the corresponding borders of the fibula. So this is the anterior intermuscular septum, that's a posterior intermuscular septum, and that is the interosseous membrane. Now the next thing we have to draw is a transverse intermuscular septum that will run here. It will divide the this is a transverse intermuscular septum. Okay. Now here you have the anterior compartment. Here the posterior compartment, because of the transverse intermuscular septum, is divided into a deep and superficial muscle group, and this compartment is the lateral compartment or the peroneal compartment. Lateral or peroneal compartment. So the anterior group of muscles will be seen between the anterior border of the tibia and the anterior intermuscular septum, while the posterior will be seen between the medial border of tibia and the posterior intermuscular septum. Thank you.